Hello, my name is Raquel. I'll be your nurse today. What is your name?
Jordan Status,
Okay, awesome. And what is your date of birth?
July 9, 1959.
Okay. So I'm just going to ask you some questions just to get a better understanding of your health and overall wellness. Is that okay with you?
It's okay.
Okay. So what brought you in today?
My blood pressure started getting high.
So you notice that it's high. Okay. So what is the numbers that you've been getting?
140 over 88. The lowest is 135 over 84.
Okay. How long have you noticed this exactly?
3 weeks ago.
3 weeks ago. Okay. 3 weeks ago. And so 3 weeks ago. How have you been able to check?
My brother, since my blood had disease running in our family, my daughter brought me a machine. That's what I've been using since.
Okay, blood pressure. That was very nice of her and very smart. Okay, so how often do you check?
Daily.
Daily. Okay, do you check? And how often in the day?
Early morning and then late in the evening.
So about 2 times a day.
Twice a day, yes.
Okay. So do you check sitting up?
Sitting up.
Okay. Do you assure that maybe you're calm and well rested prior to you checking at least 15 minutes before?
Yes.
Okay, that's good. It's good that you know that. And it's good that you also know how to check your blood pressure. Do you have any chronic illnesses?
No.
No chronic illnesses. Do you struggle with heart disease, like with cholesterol or anything?
No.
Okay. Do you smoke cigarettes or marijuana?
No.
Okay. Do you do drugs?
No.
Okay. Do you smoke? Do you drink?
No, I don't drink.
You don't drink? Okay. Thank you. Are you taking any over-the-counter medication?
Yes, I take high protein.
High protein. And this would be, is this
Natural
remedy. Okay. And what does it do for you?
It's helped me control the blood pressure.
Control blood pressure. Okay, noted. And how did you learn about this medication?
There's a nutritionist at the health food store that helping me, told me exactly what's good for it.
Okay, and you feel like it works?
It's working.
Okay. Do you drink herbal tea?
Gunpowder.
Gunpowder or green tea? It's like a
green
tea,
it's like
right?
a green tea.
Yeah, I think I've heard of that before. Natural remedies. So you like natural remedies, natural.
Yes.
Okay. So what are you taking? I'm sorry. Do you take any prescription drugs?
No.
No. Okay. Are you allergic to anything?
No.
Okay, not allergic to anything. Do you have any pain anywhere? No pain. Do you have any vaccines? Do you have all your vaccinations?
Oh, I have all my vaccines.
Even your childhood vaccinations, flu shots.
Yes.
All of them are updated.
Yes, they're all updated.
Okay. Does anyone in your family, including yourself, have any history of cancer?
No.
No cancer. Okay. Do you feel like you eat healthy?
I eat healthy.
Okay. What is your diet like?
I eat fruit, mostly fruit and vegetables. Okay. Sometimes some pasta, but wheat one.
Okay, wheat. Okay. Do you drink soda?
No soda, no fried food, nothing like that.
Okay. Wow, that's amazing. That's very commendable. I try to get my patients to do that, Do you exercise?
Daily.
Daily. Awesome. And how long do you exercise?
30 minutes or so.
Okay, and do you exercise in the morning, afternoon, evening? Okay. Morning. So you said that heart disease runs in your family. So who in your family?
I have a brother who just recently, 2 weeks ago, died from a heart attack.
Oh, I'm so sorry to hear that. 2 weeks ago. And how are you stressed right now? How are you?
That's what's stressing me out. My blood pressure is starting getting high, sky high, and that really stressing me out.
Okay, I'm so sorry to hear that. And how have you been coping and managing?
And my family, I talked to them on the phone. My friends, they all calling me. So that's how my stress kind of getting better.
Okay. Are you religious?
Yes, I'm a Jehovah's Witness.
Okay. And do you also um you're Jehovah's Witness. So do you read your Bible? Do you?
Yeah, daily, and then I have to prepare my meeting. We have 2 meetings a week,
Okay.
5 meetings a week, so I have to prepare all of them. So that helping me for my stress too.
Okay. So this helps you with your stress. Okay. All right. So you said that you're Jehovah's Witness. That's actually very important to note. I want to know. So if need be, would you abstain from taking blood if requested?
I will abstain.
You abstain. Okay.
Mm-hmm.
Thank you. That's very helpful to know. Um, Thank you for that. Do you have adequate access to health services?
Yes.
Okay. And what about your family? Do they also?
They also.
Okay. All right. Thank you. So I'm done with the questionnaire aspect. Um, do you mind if I check your blood pressure, your oxygen saturation to see if your your tissues in your body are getting oxygenated with blood adequately, and I'm going to check your pulse also as well.
Okay.
Okay, so you can sit where you are. You're good. So I'm going to check your blood pressure. Okay, can you just put your arm in right here, please? Okay. So just try to relax, stay still. Could you bring
Stay
up that arm
still
thing?
and do not talk until the measurement is complete. Your systolic pressure was 121 millimeters of mercury. Diastolic pressure was 85 millimeters of mercury. Pulse was 65 beats per minute.
Okay, awesome. So your systolic is 121, and your bottom, which is diastolic, is 85, which is very good, and it's good. Yeah, and your heart rate is 65, which is also good. So, and I'm reading your SpO2 which is your oxygen saturation of your tissues, the blood. It is 98%, and it also reads that it's 65 for your heart rate. Okay, so I just have a question I want to know. Okay, so I'm going to be performing a physical assessment with you. Is that okay?
Okay.
That's okay?
Okay.
So now I'm going to just give you a little bit, I'm going to tell what it's about. So physical assessment, I'm just going to assess just your overall health. I'm going to come in physical contact. I'm going to assess your head, your chest, to make sure that your lungs are good. Um, Make sure that your lungs are healthy. And I'm going to also assess that your heart is also healthy. So that means I'm going to have to come in contact with this area as well as here. And I'm going to have to also touch your head. Is that okay with you?
No problem.
Okay. So.
So can I just do it in my t-shirt on?
Absolutely. If that's what's comfortable for you, absolutely. So I will keep that in consideration in mind. Okay. All right. Thank you. So we can begin. Hello. So now we're going to do the physical assessment aspect. I asked my patient if she's comfortable with doing the assessment. You can ask again. Are you comfortable with doing the physical assessment?
Yes.
Okay, great. Doesn't hurt to ask twice. So the first thing that we want to do is just upon coming in, you want to assess your patient overall. You want to inspect, right? You want to make sure that your patient is good overall. This means using your senses as well. You want to smell to see if there's any odors that your patient may be emitting. You want to be able to just look at your patient to see if there's any abnormalities. Is your patient kempt? You want to assess to see your patient's posture, how they're sitting. You want to look at their face, their hair. So the first thing that I'm going to look at is the shape of her skull and head. So you know you have the frontal lobe, the parietal, the temporal. You have the occipital, and you have the am I missing one? Occipital. Yes. And so you want to assess that everything is equal, symmetrical to one another, like the parietals, the temporal. There's no lumps, no bumps. There's no swelling of the head. You want to just check the overall circumference of her head. You want to also check the shape of her head and her face to make sure maybe if her face is moon shaped, this might tell you that the patient may be experiencing Cushing's. You want to assess if her face is equal. These are all the things that you're going to be looking at upon coming in. So the first thing that I would like to do is assess if her head is proportionate to the rest of her body. As you can see, it is. It's not too small. It's not too big. It's proportionate for her body. Then you want to assess the positioning of her head. Is it midline? As you can see, it is midline to the rest of her body. And then you want to assess her hair. How does her hair look? Now, it's great that she's facing the window. So, like, if you look, so for this aspect, I would say